Among those in Boston trying to do something in response to COVID-19 are members of the Boston City Council, and joining us is one of the at-large members, Michelle Wu. Thank you very much for being with us, Councilor.
Thanks for having me, Chris.
Councilor, I want to start with the new figures the city released yesterday on who's bearing the brunt of COVID-19 in Boston. You've seen the maps that have come out both about COVID-19 and about some other disparities in the city. What do you take away from that?
The maps look very familiar, and it really reflects the fact that COVID-19 is a very sudden and in some ways unpredicted pandemic, but at the same time, it is just reinforcing the longstanding, pre-existing underrepresentation and disparities that many communities have faced day in and day out, whether it's on the public health side or access to stable housing or food access. These very same communities now are really bearing the disproportionate impact of having to adapt and deal with COVID-19.
Now, sometimes, there's a habit of talking about this in terms of a community's deficits, but what I read into it is there are a lot of people who have to leave the house to go to work, and they're not going there in a car. I guess that could be a factor too, couldn't it?
Absolutely. I mean, when we are essentially trying to limit people's movement, whatever is present in your neighborhood or absent from your neighborhood is very much magnified. So the places that were already food deserts without great access to fresh, affordable, healthy foods, or the places where there might have been less open space. Now, when people are asked not to go outside of their own neighborhood, it makes it much more difficult to lead your lives and to access that stability. We also see particularly that the neighborhoods where there's a greater risk of displacement to begin with are now, in fact, a kind of doubly hit in an economic situation, because many workers were hourly wage workers who didn't have protections, aren't able to work remotely, and now may not even qualify for some of the stimulus packages or support that's available.
Now, the City Council has limited power to make things happen in a direct way, but you certainly sharpened the focus on some critical needs right up front for renters and also for people who are renting commercial space. Can you tell us a little bit about that?
Yeah, as you say, much of this lies at the state and federal level in terms of being able to issue a blanket stay or deferral or moratorium on rents, mortgages, and other payments that could help make it more affordable to be in one's home during this. However, the city should be taking every possible step that is within our immediate authority to do. That includes looking very carefully at city-owned and Boston Planning and Development Agency-owned buildings. We have commercial tenants, for example, in the Bowling Building in Roxbury, who are wonderful anchor institutions for our neighborhoods, and many of these businesses are struggling. The city and the BPDA should not be asking these commercial or residential tenants to be paying rent at this time. I've also filed a hearing order in partnership with Councilors Kenzie Bach and Lydia Edwards to look at deferring property taxes even further than the 1 month period that the state has granted any municipality to take. This will last longer than just a few more weeks. We are looking at impacts that will ripple potentially for years at this point, but we do know that the restrictions to require physical distancing, to keep non-essential businesses closed, to keep schools closed and childcare closed, these will likely last beyond just the month of April. And so we have to recognize the fact that in allowing and empowering people to follow the government directives for public health, we have to make it possible for them to have economic and financial stability too.
Well, as this virus has made its rounds, I think our perceptions have changed, but the earliest on our radar screen was for a lot of people through demographic profiling. Is that still a problem?
Absolutely. We started back, must have been a month ago at this point, or a little over a month ago, that before there were cases or situation of community spread in Boston or really in the United States, when the virus was just starting to circulate in other countries, we were noticing that misinformation and in some places open racism were leading to Asian American communities, Asian American owned businesses being hit particularly hard. And so when many of us in Boston rallied around Chinatown and our API communities, there was a tremendous outpouring of support. Now, unfortunately, the situation is very different these days because not only has the virus come to Boston and basically every city in the United States, we've stopped the ability for these community institutions like our local restaurants to be able to be community gathering spaces. So we continue to maintain a vigilance against racism of any kind or associating this virus with any particular group. Certainly the actions on a regular basis from the president and his administration in DC do not help on that front. But in Boston, it means that we have to continue pushing for data to be available, to know on a regular basis which neighborhoods, which demographics, which age groups are struggling most with COVID, and then making sure that that doesn't just reflect where there's more testing happening, but that actually reflects awareness, knowledge, and that we are providing support to everyone across the board.
Could you unpack that a little bit? Why is it so important to do more testing right now?
Because we have lagged so far behind when it comes to the time scale at which we knew there were first cases and the beginning of widespread testing, the numbers are a little bit deceptive. And we are still short of where we need to be. We're not able to test everyone at this point. There are certain locations set up in Boston where it might be for first responders or essential workers or others who have a certain seriousness of symptoms that they need to know and can reach that level of qualifying for that testing to be available. And as testing is ramped up, we've loosened those restrictions so more people are able to access it. But it's still nowhere near where we really should be doing to stop this disease and virus as quickly as possible.
I was watching your conversation with the environmental journalist, Bill McKibben. It reminded me how much epidemics have always gone hand in hand, even back to ancient times, with economic expansion. In the months ahead, I see a lot of pressure to get the economy here going again. Are you worried about what that's going to do?
We know historically that under major pandemics, there is a peak, but of when the virus has spread out in the community, and we've been doing our best to make sure that the healthcare system can respond with the capacity for that peak in cases. And so that's why you hear people saying flatten the curve as much as possible. But what we also know historically is that there tend to be multiple peaks, because as soon as you get past that first one and then everybody kind of relaxes the distancing requirements, because they do have such a devastating economic impact, once people are coming into contact with each other again, if there hasn't been a vaccine developed by that point, which is looking years off right now, there may be another surge in how many people are coming into contact and therefore transmitting this virus. So this will be something that we have to think about for a long time. That's why I know many of my colleagues on the council and I are pushing for the conversation to be not just immediate triage, but on the long-term recovery and how we can ensure that it's an equitable recovery that reflects the disparities and injustices that existed prior to COVID, but that in directing resources, we can ensure everybody is able to access that support.
I want to ask you about one other part of the experience that you've had. You're a parent of school children. I'm sure you've had some education going on at home. Does that give you any reason to reflect on inequalities about some people being able to handle that better than others, maybe?
We are being set back in so many ways, and one of the biggest struggles is this the closure of schools and childcare centers. I feel very lucky that my husband is home as well, and we're both able to work from home. It's exhausting for any family, and I think the mental health impacts for all working parents, especially now, need to continue to be lifted up and prioritized. I was planning for this interview to be a quiet conversation and all the doors are closed and everything, and someone has joined. I don't know if you can even see it. Someone has joined me, luckily quietly coloring right behind me.
A model student.
But what we know is that, it's not enough just to say we're going to try to do online distance learning and we'll try to distribute as many laptops as possible to students. We know that even in the distribution of laptops, there's been some issues that have come up. Addresses have changed or families haven't been in touch. And so the students who may most need access to that technology can be most difficult to find and reach to give them that technology. And even once they're equipped with the technology itself, are they in an environment that is safe, and then quiet and conducive to learning? Many parents don't feel equipped to be the teacher in this situation, whether it's given their own educational backgrounds or what they're juggling with their jobs at the same time. So again, in that conversation about equitable recovery over the medium and long term, how we think about bringing, addressing this learning loss for so many of our students and children is going to be a huge part of that.